This is a presentation on OPNAV instruction 6103 alpha, the deployment health assessment process. So let's start by taking a look at the SSIC code of this instruction. First off, we notice it's an OPNAV instruction, meaning it's going to apply throughout the Navy. It falls under the 6000 series, which means medicine. And then the secondary number of the 1 right here, the 6100, well, that means within medicine it falls under physical fitness. So let's take a look at the rationale. The deployment health assessment process supports the Department of Defense health protection strategy to deploy healthy, fit, and medically ready forces. It minimizes illness and injuries during deployment and evaluate and treat physical and psychological problems afterwards. So what we're trying to do with this deployment health assessment is make sure that the people we deploy are physically and mentally fit, that their individual medical readiness is complete and ready to go. So that is why this falls more under physical fitness. The deployment health assessment consists of 3 components. And those will be the DD 2795, the pre-deployment health assessment. We've got the DD 2796, the post-deployment health assessment, and then we've got our DD 2900, the post-deployment health reassessment. And we'll talk about these a little bit more in the following slides. So it's important for us to understand that the deployment health assessment does not replace a PHA. It's there to augment your periodic health assessment. It's not intended as a substitute, and we'll talk about how these are interrelated a little bit more here. But first, let's talk about a couple of terms related to the deployment health assessment process. We need to define what a deployment is, and we also need to define what a redeployment is. We're going to call a deployment a relocation of forces and material to a desired operational area. And for the deployment health assessment purposes, this has got to be a period greater than 30 days. Okay, so deployment, relocation of forces to an operational area greater than 30 days for the deployment health assessment process. We're going to define a redeployment as a return of personnel from deployment to the home or demobilization station for reintegration or out processing. So this is coming home from a deployment. This isn't another deployment. When we say redeployment, when we're talking about periodic health assessments, we're talking about coming home. Okay, so applicability for both of these. Deployment ashore for more than 30 days with duties involving operations outside the continental United States without fixed U.S. medical treatment facilities. So that's some further definition of our deployment. And then we can also do deployment health assessments if the combatant commander determines that a health threat exists regardless of the area, duration, or MTF support. So traditionally, deployment should be greater than 30 days, in an operational area without an MTF, but if the combatant commander determines that, hey, you know what, despite, not meeting those requirements, there was a threat, to my crew's health, so they need deployment health, post-deployment health assessments and reassessments, he can make that determination. And examples of an instance where this would have happened is like if a deployed ship is exposed to some contaminants or disease or some sort of traumatic event, well then in that case, even though we don't go on land somewhere for greater than 30 days, these are instances in which a post-deployment health assessment and reassessment would be appropriate. Moving on to some policy. So the appropriate deployment health assessment shall be completed electronically by the service member in the required time frame. So we haven't talked about our time frames yet. We're just about to get into that. But the first thing that needs to happen is a service member who's either getting ready to deploy or has redeployed, has come back home. They have to go into the electronic deployment health assessment database and complete the health assessment electronically. That's their portion of it. Then, following a face-to-face interview with the healthcare provider, they will review and certify the deployment health assessment. Okay. After you've done it electronically, you have to have an appointment with a healthcare provider, and they have to see you face-to-face, and then they could certify and sign off on that deployment health assessment. So who's a healthcare provider that can do this? Well, that's going to include physicians. That's going to include your PAs, your physician assistants, nurse practitioners or advanced practice nurses, and then your IDCs, your independent duty corpsmen, your independent duty med techs, and then your special forces medical sergeants. We're going to move on to the actual pre-deployment, post-deployment, and post-deployment reassessments. So we're going to utilize the DD 2795 as our pre-deployment health assessment, our DD 2796, that is our post-deployment health assessment, and our DD 2900, That is our post-deployment health reassessment. For our time frames, well, we've got to know when the deployment was, okay? So our time frames are going to be based off of the deployment. Your pre-deployment health assessment, your DD 2795, well, the window to do that is when you're within 120 days of the deployment. You don't want to do it 125, 180 days out. You want to be within 120 days to the deployment. Within 120 days prior to deployment, you're going to do your DD 2795, which is your pre-deployment health assessment. Your DD 2796, well, that is going to be done either 30 days before or 30 days after redeployment. Okay, you don't want to do it any earlier than 30 days before coming home. So you could still do it while you're in theater, right? As long as you've got 30 or less days left. And then you can do it once you get home, but you don't want to wait any more than 30 days. So 30 days plus or minus redeployment, that's when we're going to do our DD 2796, which is our post-deployment health assessment. And then moving on to the post-deployment health reassessment. Your DD 2900, well, the time frame for that will be 90 to 180 days after you've the redeployment, after you've come home. So 3 months to 6 months after you've come home, that is your time window for doing your 2900, which is your post-deployment health reassessment. So some more policy we got to cover. Service members who deploy for more than one 30-day period, right? They go on more than one deployment in 12 months. We're going to call those frequent deployers. Well, we're just going to do their post-deployment health reassessments concurrently with their periodic health assessment, right? We're going to do it with their PHA, and our instruction on PHA is a SecNav instruction 6120.3. See, there we go. We know our SSIC code 61000. Secondary number 1 has to do with physical fitness. Our PHA is done to make sure that our IMR, that our individual medical readiness is good to go, that we are physically fit and ready to deploy. Service members who receive wounds or injuries that require hospitalization at an MTF before they return to their home station, well, they will do their post-deployment health reassessment. They'll do their DD 2900 90 to 180 days after they finally get home. So if you get injured on deployment and on your way you have to stay, in a hospital at an MTF that is not at your home station, your time doesn't start for that post-deployment health reassessment until you get back to your parent command, till you get back to your home station. And then service members separating from active duty prior to the 90 to 180 day window, well, we'll do their PDHRA, we'll do their post-deployment health reassessment with their separation physical, with their separation health assessment. They will be done concurrently if you are getting out before that 90 to 180 day window. And then service members who are overdue for their 2796, their post-deployment health assessment, or their DD 2900, their reassessment, they cannot complete their NAVPERS 6100/3. Well, what do we think a NAVPERS 6100/3 is? So it has to do with Navy Personnel Command, and it has to do with physical fitness. So can we rationalize our way into what this is by knowing our SSIC? All right, so your NAVPERS 6100/3, well, that's your physical activity risk factor questionnaire. That's your PARFQ that has to be updated in the PRIMS, right, in the Physical Readiness Information Management System. So you cannot do your PARFQ, right? You cannot do your PARFQ and update PRIMS if you are delinquent on your post-deployment health assessment or your post-deployment health reassessment. Okay, and that's important to understand, because if you can't update it, then you can't run it, and that will be counted as a PRT failure. So before we review what we've gone over so far, let's see how this instruction relates to some of the other instructions we might have already studied. So we're talking about the OPNAV instruction 6100-3 alpha, right? The deployment health assessment process. And we know the 6 makes it medicine and the 1 makes it pertain to physical fitness. Well, we've already seen the relationship of this instruction with the SecNav instruction 6120.3, which is our periodic health assessment. If you're due for a post-deployment health assessment or reassessment, you should do it at the time of the PHA. A PHA cannot be complete if you are still pending a post-deployment health assessment or reassessment. I mean, if it's overdue, okay? We also know that we can't be compliant with OPNAV instruction 6110.1, which is our PFA instruction, right? Our PRT, our physical readiness test, is an OPNAV instruction. 2, there's a medical part to it, so it falls under the 6000 series. And then the 1, of course, and you know this is about physical fitness. So you cannot do your PAR-FQ, your NAV-PERS 6110 slant 3, right? And notice how the form matches the instruction almost, right? It still follows that SSIC code because it is a Navy form from Navy Personnel Command. So we cannot complete this form if we don't have an up-to-date PHA, and we cannot complete this form if we do not have if we are delinquent with a post-deployment health assessment or a reassessment. So I just like to see how these are all interrelated, and if these instructions, like these two, like fall on your bib, you should study them together. And then I'm just going to throw this in there for the sake of review. So our SecNav 6120.3, our PHA, is also closely related to SecNav instruction 6224.8, which is tuberculosis, right? 2 means preventative medicine. The tertiary 2 means communicable disease. And if we can't do our PHA, we can't comply with this instruction, so we can't fill out the form 624/8, which is our periodic risk assessment for tuberculosis exposure. And then we also cannot do the requirements of Man-Med Chapter 15, which is physical exams. So a little bit of review what we've gone over so far. What form numbers are the pre, post, and post-deployment reassessment? What are the form numbers of the pre, post, and post-deployment reassessment? We have the DD2795 for our pre-deployment health assessment. We have the DD2796 for our post-deployment health assessment, and the DD2900 for our post-deployment reassessment. And you got to keep in mind that these are done throughout all the branches. So that's why we don't get a nice Navy form. That's why we don't get a NAVMed form that matches the SSIC code. These are forms that are going to be used throughout the Department of Defense, so they don't fall under Navy SSIC codes. What are the time frames in which each needs to be completed? What are the time frames to do our pre-deployment health assessment, our post-deployment health assessment, and our post-deployment health reassessment? Well, we need to know the deployment. We're going to do our DD2795, right, our pre-deployment health assessment, when we're in that 120-day windows, right? 120 days prior to the deployment, that's when we want to do it. We're going to do our DD2796, our post-deployment health assessment, when we are 30 days plus or minus from redeployment, meaning when we've only got 30 days left in theater or we're 30 days past, but no later than that. And then our DD2900, our post-deployment health reassessment, well, we want to do that 90 to 180 days after. Who is considered a frequent deployer? Who is considered a frequent deployer? A frequent deployer is someone who deploys for more than one 30-day period in 12 months. Somebody who goes on more than one deployment, that's over 30 days for a period of 12 months. When are post-deployment health reassessments completed on a frequent deployer? When are post-deployment health reassessments completed on a frequent deployer? Well, they're going to be done during their annual periodic health assessment, during their annual PHA. What form number is the PAR-FQ? What form number is your personal assessment risk factor questionnaire? Well, that's your NAV-PERS 6110/3. NAV-PERS 6110/3. All right, we're going to finish up by talking about some responsibilities. So we're going to talk about the responsibilities of the Deputy Chief of Naval Operations, Manpower, Personnel, Training, and Education, the Commander, U.S. Fleet Forces Command, Navy Bureau of Medicine and Surgery, or BUMED, Echelon 2 commands or supporting commands, the commanding officers, and Navy Mobilization Processing Sites, NMPS. So your Deputy Chief of Naval Operations, Manpower, Personnel, Training, and Education, they've got to develop and maintain a deployment health assessment policy, provide quarterly compliance reports to the Chief of Naval Operations, ensure that MERS supports the Medical Readiness Reporting System, supports the Deployment Health Assessment Reporting process, and provides a capability to pull Navy-wide drill-down reports. And they need to maintain interface with the Navy and Department of Defense information systems to support the Deployment Health Assessment process. Your Commander, U.S. Fleet Forces Command, they need to develop implementing guidance that ensures deploying personnel are briefed on deployment health threats and are trained and equipped with appropriate countermeasures. They got to provide quarterly compliance reports to the Office of Chief of Naval Operations, Navy's 21st Century Sailor Office, the OPNAV N17, by the 30th of the month following the end of each quarter. BUMED responsibilities are going to include providing command level and medically related support for service members to complete their deployment health assessment. They're going to maintain deployment health centers. They're going to maintain centers near MTFs or on bases that can help move along the deployment health process, right? So we can get those pre-deployment health assessments and those post-deployment health assessments completed. They're going to ensure that individual medical readiness data is accurate and up to date to facilitate smooth deployment processes. They're going to provide OPNAV N17, the 21st Century Sailor Office, medical policy guidance related to the deployment health assessment process. Navy Marine Corps Public Health Center is responsible for maintaining the EDHA database, the Electronic Deployment Health Assessment Database. This is the database that service members need to go into to complete the pre-deployment and the post-deployment health assessments, and this is what will be certified by the healthcare provider when they sit and have that face-to-face with the service member. They need to validate deployment health assessment during the periodic health assessment, which is also required to complete your PRT. So if you don't do your post-deployment health assessments and your reassessments, if you're delinquent and you're not medically waived from a PRT, that's going to be counted as a failure, because if you can't do your PRFQ, you can't run the PRT, it's recorded as a failure. And then they're going to provide appropriate education on the deployment health assessment policy, medical guidelines, and information technology systems. So they're going to make sure that that the fleet, the providers are educated on the policy, that they know the medical guidelines set forth within these assessments, and that we have the appropriate information technology systems like the electronic deployment health assessment database, and also MERS, the medical readiness reporting system. They're going to make sure that they're responsible for making sure that we have all that stuff available. Your Echelon 2 commands, or your supporting commands, they're going to support monthly reports to the commander, U.S. Fleet Forces Command, and they're also going to monitor and ensure deployment health assessment compliance. Commanding officers, they've got to ensure members deploying to areas requiring physical health assessments are briefed on the health threats. They got to ensure members are trained in the tools and assets available for deployment and post-deployment healthcare support. They've got to ensure that the DD-2795, the pre-deployment health assessment, the DD-2796, the post-deployment health assessment, and the DD-2900, the post-deployment health reassessment, are completed within an appropriate time frame. Active duty service members stationed remotely from a medical treatment facility, they can call the DoD-sponsored PDHRA call center at this number, 1-888-734-7299. But this is only for people that are remotely stationed, that they are not near a medical treatment facility. Reserves can complete the PDHRA through the Department of Defense Health Affairs, either at their NOSC, their Navy Operations Support Center, or by calling the DoD-sponsored PDHRA call center. Reserve members indicating health issues on their post-deployment health reassessment, they can be approved for a one-time line of duty authorization for medical evaluation to determine if treatment is indicated. So a reservist who goes on deployment and then is deactivated, right? He's no longer on that active status. If on his post-deployment health reassessment, he indicates that there's something going on deployment related, well, he's going to be authorized to have a medical evaluation at the Navy's expense to see if there's any further treatment indicated as a consequence of that deployment. And then your Navy mobilization processing sites. Well, these guys are going to ensure that all reporting service members complete their DD-2795, their pre-deployment health assessment. So this is for people who are going individual augmentees. They report to these Navy mobilization processing sites before they deploy. So the Navy mobilization processing sites are going to ensure that all reporting service members complete their pre-deployment health assessment, the 2795, and they're going to ensure that conditions resulting in non-deployable determination are documented for follow-up by the primary care manager upon return to the parent command or to the Navy Operational Support Center in the case of reservists. So all this is saying is that if during your pre-deployment health assessment, the Navy mobilization processing site sees that there's something that on there that makes you non-deployable, well, you're going to have to go back to your parent command and follow up with your PCM, or if you're a reservist, you're going to have to go back to your NOSC. Okay, that concludes this presentation. This is all from your OPNAV Instruction 6103 Alpha Deployment Health Assessment Process. Like always, I hope these are helping you guys out. Keep studying. You got it.